Obesity doesn't come alone. Yes, you heard it right. Obesity doesn't come alone. Hi all, this is Dr. Nishita Reddy, consultant endocrinologist at Dr. Nishita's Endocare, Nellore. Obesity is the disease of current generation. So obesity is on the rise in India, both in urban and rural population. India ranks among top 3 countries in the world. The people living with diabetes, around 254 million people are suffering with generalized obesity, whereas 351 million people, we can see the increased incidence of abdominal obesity. So, and this abdominal obesity more prevalent in women, around 50%, whereas in men 30%. So what is this abdominal obesity? So this abdominal obesity is very important because it puts the individual at increased risk of insulin resistance and inflammation and many comorbidities. You may look thin outside but still fat inside, that is metabolically unhealthy, even if your BMI is normal and your weight is normal. So a normal BMI or weight doesn't always equate to normal health. So you have to check waist circumference also, especially in our ethnicity wise and Indians, so more prone to abdominal obesity. Obesity doesn't come alone. Overweight or obesity increases the risk of almost 230 plus complications in our body. So it can affect almost each and every organ, including there is increased risk of diabetes, hypertension, dyslipidemia, that is abnormal cholesterol levels. It increases the risk of heart attack, coronary heart disease, stroke, and also the increased risk of osteoarthritis, that is knee joints get affected early, and so increases the risk of obstructive sleep apnea, and also the cancer risk also will be high in such patients. So the obesity management is not just about the weight loss. It is like if the person loses almost minimum 10 to 15% of weight, we can improve the overall health and quality of life in that patient. So even 15% of the weight loss can make the patient with diabetes go into reversal or remission state. And also it can improve the ejection fraction in heart failure patients. And also in pre-diabetics, if suppose they lose 10% of the weight, we can stop that progression from pre-diabetes to diabetes with even 10% weight loss. Even 1 kg weight loss will drop your HbA1c level by 0.1%. So the obesity is the major cause of CV mortality. So we can see the increase like 3 times the increased death rate, CV death rates nowadays because of the obesity. So such immense is the the obesity. So it has become like global epidemic, we can say. So the obesity management will be the holistic management. It's not only about weight loss. So all of you talk to your expert doctor right now for the more innovative and smart solutions. So many newer injections are available so nowadays for obesity management. So thank you.